Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about sunscreen basics. Sunscreen is something that I am constantly going over every day, multiple times a day, to patients in my practice, and I just thought it would be useful to put all the important things about sunscreen in one podcast. So, firstly, what number to use? I usually recommend a 30 or above. The SPF has to do with sun protective factor, and it has to do with how much longer it will take for your skin to burn if you're wearing the sunblock, which is important to understand. So if it's an SPF of 30, it will take your skin 30 times longer to burn. Now, if you have type 1 extremely pale skin, you might burn in the sun in 5 minutes. So 30 times longer than 5 minutes is not all that long. So the most important thing about sunscreen, in addition to getting a 30 or above, is to make sure that you reapply it. And that is where I think people really mistake it. They think that you can just put your sunblock on and you're good all day, or at least for half a day, and it is just not true. Sunscreen needs to be reapplied every 1 to 2 hours. Certainly every 1 hour if you are extremely fair-skinned, or if you're swimming, sweating, or in a windy area. So reapplication is key. The SPF 30, it should be a broad spectrum sunblock. Really, most things at the store are broad spectrum, but you want it to say UVA, UVB blocker, SPF 30 or above. You need to reapply it. And then what happens when you have an old bottle of sunblock lying around from last year? Can you use it? And my answer is, if it has an expiration date on it, check the expiration date. And if it's past expiration, sunscreen is one of those things that I don't think it's worth chancing it. I would just throw it away. If it doesn't have an expiration date on it and you're not sure when you bought it, I also would tend to tell you to throw it away and get a new bottle. In terms of ingredients, my favorite sunscreen ingredient is zinc oxide. It doesn't always say that on the front, but if you're looking at sunscreens and there's so many at the store and you flip the bottle around, on the back there is a little spot that says active ingredients. And sometimes there's a whole bunch of chemicals that you can't pronounce, and sometimes it says zinc oxide, and sometimes it's a combination of those two. But I would prefer patients to use something that says zinc oxide. Now, sometimes zinc oxide can be white and pasty, and that is why people don't like it, but there are a lot of good formulations of it these days that are much easier to apply and not as white and pasty, or you can get a tinted version of a zinc sunblock, particularly for the face. Patients will often ask me, well, what about SPF 50? I use SPF 100. And the answer is higher is better, but it's to a lesser and lesser degree the higher you go. So if you have particular issues, you're very fair-skinned, you have a history of skin cancer, you have melasma or hyperpigmentation, then yes, certainly try a higher number sunblock, but bare minimum would be really a 30 for general people and general use. I also tell people that the best sunblock is the one that you will use all the time. So if you don't like a zinc sunblock and you'll use the other kind with all the unpronounceable ingredients, then use that. It will work perfectly well. I just find zinc to be the best and safest ingredient, but the other ingredients work well too. The other mistake that people make with sunscreen is they put it on sparingly instead of generously. Sunscreen is the kind of thing that you want to glop it on. You want to put on a lot of it, not just a little teeny tiny bit. When you're using the same bottle of sunscreen all summer, you are not using enough. You should be going through multiple bottles for the sunny seasons. Or if you're in the sun all the time, you should be going through many bottles of sunscreen. So some people will say a shot glass is enough sunblock to use on your whole body. I just say, when in doubt, put more on. Make sure you put a nice thick coating. The other problem that people run into is they forget to put sunscreen on certain areas. You need to use it on your neck, the front and the back of the neck. Don't forget your ears. Don't forget the tops of your feet. These are common areas for burns that people get when they forget to put it on those areas. Then a lot of people ask me about spray sunscreens, and sprays are not my favorite, but again, the best sunblock is the one that you're going to use. If you want to use a spray, just make sure that you use it effectively. There's a lot of times where people just sort of spray it into the air and assume that that's getting on their skin. That is obviously not effective. We all have seen people do that at the beach. So if you're going to use the spray, just make sure you get it on, again, a thick coat. And again, I recommend for most sunscreens trying to rub it in a bit. There are some zinc sprays. They're hard to find, but those are very nice products. Those need to be rubbed in. The continuous spray is sometimes useful. I know sometimes people like to use those on kids. Again, I really prefer zinc products, especially on children. But the sunblock, if you're going to use it, then that's the best one for you. The other place that the sprays are really useful is on the top of the head, in the hair, if you are not going to be wearing a hat. A lot of people will forget their part line and get a burn on the top of their head. One of the other issues that comes up is people who wear makeup with sunblock in it, and they will tell me, well, my makeup has sunscreen. And I will say, well, that's great. Your makeup is on all day, but the sunblock aspect of it is gone in 1 to 2 hours. Sunscreen only lasts a few hours, so you need to reapply. And for people who wear makeup, they don't necessarily want to reapply a creamy sunblock on top of their makeup. And that is where powder sunscreen is extremely useful. And there are multiple different brands of powder sunscreen. And powder sunscreen is a great thing to keep in the car, keep in a handbag, and use as the day goes on. I am not a fan of it at the beach because I just worry that it isn't really good enough for the beach, but for daily use, walking on a city street, in and out of buildings, or in and out of a car, in the suburbs or in rural areas, and for somebody who wears makeup, I think it is a great additional product. When we're talking about sunscreen, I also like to remind people about clothing. So there is nothing like clothing to help with sun protection, particularly SPF clothing like a rash guard or a body glove that you can pull over a bathing suit for children and adults. That is way better than sunblock. It does not lose its sun protective factor in the water. It is much easier to just throw a shirt on top of your bathing suit or use that as your bathing suit rather than having to rub sunscreen and then you miss a spot on your shoulder and you get a burn. So I'm a big fan of sun protective clothing. You can also get just regular sun protective clothing in a cover-up or regular shirts, and those are fine too. Regular clothing is helpful. Sun protective clothing is helpful. And there is nothing like a hat. A baseball cap will shield the top of the face, but it does not shield the back of the neck, the ears, the lower neck, or the lower face. So it is best to wear a hat with a brim. Sometimes people like the Greg Norman type hats for golf, or a bucket hat can be very helpful, or a hat with a brim. And hats can really help protect the face, the neck, the ears. A big hat can even help protect your shoulders and your chest. So hats are really useful. Sitting under an umbrella or in the shade is useful if you're going to be out on a field or at the beach. But sometimes people make a mistake by thinking that if they're in the shade, that they're protected and don't need sunblock. But being in the shade is not being in a blackout room. So really, even if you're in the shade or under an umbrella, you still need to wear your sunscreen. And also, people sometimes forget that the sun will reflect off of the sand or off of the water. So again, they think that they're okay under an umbrella, but you still need to wear your sunscreen even if you're under the umbrella. Sunglasses can be really useful to help protect the eyes and the skin around the eyes. It's also really helpful to try to avoid the sun from 10 to 4. So if you have a choice on when you're going to be outside doing your outdoor activities, if you go early or go late, you will be spared the strongest sun rays, and that can be also helpful. So in summary, sunscreen is great. SPF 30 or above is my favorite. Zinc oxide-based sunscreen is my favorite, but the best sunscreen is the one that you're going to use. So find one that you like and use it all the time. Remember to reapply every 1 to 2 hours. Remember to put it on all sun-exposed areas. Don't forget things like the ears, tops of feet, back of neck, etc. And don't forget to seek shade try to stay out of the harshest rays in the middle of the day, and to wear hats and sun protective clothing. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.